Preparations containing concentrated platelets for the treatment of tendinosis in humans and horses have been shown to be safe and effective. And support for this treatment approach continues to emerge. Currently, there are over 87 peer-reviewed articles assessing clinical efficacy in humans for a variety of conditions, and several times more in animal studies. In a study of people with completely torn Achilles tendons that required surgery, the presence and absence of platelet therapy applied on the surgical site before wound closure was studied in groups of 6 patients each. The surgery with platelet therapy resulted in a statistically significant decrease in the latency to improved range of motion, functional recovery, and resumption to normal training. In equine medicine, platelet therapy using a Paul device was the subject of a study and report by Dr. Roger Smith of the Royal College of Veterinary Medicine. 14 cases of suspensory ligament desmitis with lesions affecting an average 28% of their total cross-sectional areas as determined by ultrasonography were studied. The average time for the lameness score to reduce 0 out of 5, or not lame, was 5 weeks. And the average ultrasonographic score was reduced from a pre-treatment value of 2.9 to 1.25 after a 3-month evaluation. His conclusion? This easy-to-use point-of-care treatment took 15 minutes to prepare, required no instrumentation, and conferred a clinical benefit. These results led to the exploration of an autologous platelet therapy treatment approach for canine joint diseases. For references and additional case study information, visit the Paul Animal Health website or click the link on the main menu. Recently, a number of veterinarians across the country participated in a Paul Animal Health CPET pilot program. They elected to treat their canine patients who failed to respond to conventional therapies for either osteoarthritis or tendinopathies with or without previous surgical interventions. As of June 2010, the participating veterinarians have treated 50 dogs with the CPET filter-based platelet harvest system. 21 have completed the 3-month post-treatment period, for which the follow-up data are now available. And this pilot program is ongoing. And here to share some information about the pilot program and the metrics used to assess treatment efficacy is one of the participating veterinarians, Dr. Lauren Blazer. Welcome.
Oh, thank you for having me.
So, Dr. Blazer, how many dogs did you or your practice have in the pilot program, and how did they react to the treatment?
Well, as of right now, I've done four dogs, and I'm hoping to do some more in the very near future. All 4 of my patients did very well with the procedure, recovered nicely from it, and had no adverse reactions. For the first 24 hours, they were a little bit sore, but no more sore than with any kind of joint injection that I do. And after that 24-hour period, they were back to where they were pre-procedure, and then from that point on, we were assessing if they were doing better than pre-procedure.
Well, in fact, the results you experienced are quite typical. Throughout the pilot program, there hasn't been one report of an adverse clinical reaction to the CPET treatment procedure. So, how did you qualify your patients as good candidates for the CPET treatment?
Well, in my practice, I'm pretty much 85% orthopedic patients, and all these dogs are suffering from severe to moderate arthritis of elbows, of the shoulders, of the knee. We've done some of the early kind of surgeries which are low morbidity, such as arthroscopy, and we're reaching the point where we have to start thinking about more invasive procedures such as joint replacements or other surgeries where we're actually making cuts in the bone, and it's just very expensive and very hard on the patients.
Yeah, it's very invasive.
It's very invasive, and a lot of these patients are getting to be a little bit older. So I'd like to try to give them some other alternative, and when you're talking about joint replacement, that is called a salvage procedure, so you try to do something before that. And this new therapy with the platelets gives an opportunity to make these dogs better with very low morbidity and pretty much low cost to the clients.
So how did you go about assessing the progress in your patients? Did you share the Hudson Visual Analog Score, the VAS questionnaire with them?
I did. I think it's very important that the owners get involved with the assessment of these patients. These are arthritic patients. They have good days, they have bad days, and for me to evaluate them on just one solitary day isn't really giving a reflection of how these patients are doing. We need to see how they're doing over the days and how stiff they are when they wake up, how stiff they are after activity. Are they playing like a puppy, or are they getting old and hunched over when they're walking? Do they need pain medication? Do they not? These are the kind of questions that the VAS asks, and these answers are very important in assessing these patients.
Well, thank you so much, Dr. Blazer.
Oh, no problem.
Participants filled out and returned the VAS assessment questionnaire at baseline and again at 3 months after a single application of the CPET treatment. When looking for an improvement, it is important to distinguish between a small but statistically significant improvement and an improvement large enough to be meaningful to the veterinarian and the pet owner alike. Looking back at the vets who participated in the program, we found a handful that only tried CPET once and elected not to treat a second patient. Interestingly, whether or not a vet decided to stay in the program strongly correlated with the improvement they measured with the VAS in the first case they treated. Vets who saw improvement in lameness score of less than 2 points on the 10-point scale often elected not to treat a second patient. Those who observed improvements greater than 2 points stayed enrolled, even if smaller improvements appeared in patients subsequently treated. Now, we define this 2-point improvement threshold as a compelling improvement, and we use it as a benchmark to assess whether or not a dog experienced a meaningful improvement with CPET. To date, the post-treatment data shows that the CPET treatment can be remarkably effective and suggests 2 important trends. First, young and middle-aged dogs appear to respond better to the CPET treatment than older dogs. 69% of dogs younger than 10 demonstrated compelling improvements using CPET, compared to only 17% of dogs older than 10. Second, dogs with moderate to severe lameness responded better to CPET treatment than dogs with only mild lameness. This is in part an artifact of VAS, as dogs with good pre-treatment scores have less room to improve. If we account for this and only look at dogs with starting VAS scores of 6 or less, one being very lame, we see that 91% of the dogs treated with CPET saw compelling improvements. Now, of course, our data collection is ongoing, and for the latest results, be sure to visit our website. But just as encouraging as these statistical data are the testimonials offered by some of the veterinarians who participated in the CPET pilot and by the pet owners themselves.